Once kidney function drops to 30%, you should be aware of the financial and physical considerations of transplant and start reaching out to potential donors. But that can be tough.
I had some concerns. I had some fears about how it's gonna be after the transplant.
But patients like Aurelio Castillo, who go through the Hispanic Kidney Transplant Center, learn how to best prepare for transplant. First steps include determining whether your insurance includes transplant benefits. Update your cancer screenings with age-appropriate mammograms and colonoscopies. And work on having a healthy weight. Patients with a BMI of 40 or less can be candidates for transplant. Kidney transplant evaluation can begin when kidney function falls to 20% or less. It is not necessary to be on dialysis before transplant evaluation. To get the process started, you will fill out and submit a kidney transplant application, along with a health history form. Both of these forms are available in Spanish. You can get one from your dialysis center or on our website, bswhealth.com/kidney transplant, or you can call 214-820-2050. Once the application is reviewed, you will talk with a Spanish-speaking scheduler to arrange appointments. Each patient referred for a kidney transplant undergoes an evaluation that includes physical examinations and diagnostic tests. If you're approved medically and financially, you will be put on the transplant waiting list. In order to build trust and confidence, the Hispanic Kidney Transplant Center provides face-to-face education from Spanish-speaking doctors and staff who will assist you through the entire process. All forms, brochures, and educational materials are in Spanish.
They asked me if I wanted to learn more about my kidney transplant, and I said yes, because I wanted to know a lot more about my kidney transplant. And my sister also wanted to know about it.
As part of your kidney transplant evaluation, you will attend an educational class offered in Spanish. Family and friends are welcome and encouraged to attend and ask questions, so everyone can better understand your disease and how they might be able to help.
Ahí es donde yo aprendí que sí es posible donar en vida y nos dieron mucha más información. Yo no sabía que existía ese tipo de procesos aquí.
Although Hispanics are more likely to have kidney disease, they are less than half as likely as non-Hispanic whites to get a transplanted kidney from a live donor. That needs to change in order to save more lives.
The ultimate impact of this program will be really to see a greater number of kidney transplantations done within the Hispanic community. But I would say principally to see an increase in the number of living donor kidney transplants.
The fastest way to receive a kidney transplant is to have a living donor. Living donor kidney transplantation is the best option because living donor kidneys work faster and last longer. Living donor kidney recipients live longer and don't reject their organs as often. Living donor kidneys are usually a better match and in better condition. Wait time is eliminated, and surgery can be scheduled at your convenience. Research and our experience show patients with a Hispanic background are reluctant to identify potential living kidney donors.
No sabía realmente qué significaba donar. Mis más grandes dudas eran ¿cómo voy a sobrevivir con un riñón? ¿Será que podré vivir mucho tiempo con un riñón? ¿Mi vida será normal después de donar un riñón? Esas eran mis dudas.
Many Latino families fear donating a kidney to a loved one will prohibit them from getting pregnant or fathering children. That's not true. Many Hispanics are concerned that if they donate a kidney, they will not live as long, or they will have to take medication for the rest of their life. Not true either. Financial concerns are also an obstacle to live donation. However, the organ recipient's insurance covers most of the expenses for both donor and recipient, so cost should not be a barrier to donation. Others may think becoming an organ donor will trigger a report to immigration. Not true again. Does my religion prohibit me from donating? Nope. The majority of faiths, including Catholicism and Christianity, favor organ donation as the greatest act of love a human can make.